My name is Rut and I'm the chair of Riksår steering group. Riksår is the Swedish National Quality Registry for ulcer treatment for hard-to-heal leg ulcers, foot ulcers and pressure ulcers. Hard-to-heal ulcers and wound management is a huge challenge for patients and their relatives and also for the healthcare sector, not only in Sweden but globally. The cost for wound management have been estimated to 2 to 4% of the healthcare budget annually. But the cost will rise in the future because of longer life expectancy and a larger patient population with diabetes mellitus. In Sweden, the costs are estimated to 2.3 billion annually. But it's not the costs that are essential here. It's the patient's suffering, pain, impaired health-related quality of life, and social isolation. This cannot be measured in Swedish crowns or dollars or euros. When I started as a GP 30 years ago, I was astonished to see so many patients with hard-to-heal ulcers coming to the healthcare center for dressing changes. They came once a week, several times a month, and even during a year. And how come? How did this happen? And why were not my fellow colleagues interested in wound management? I realized that these patients didn't have a proper diagnosis, and hence they didn't get the optimal treatment. And as a GP, I can choose between at least 42 different diagnoses for hard-to-heal ulcers. And these patients also didn't have a continuity of care, and they were treated by different caregivers on different levels of caregiving. So to start with, I really wanted to have a structured working process to help staff set the proper diagnosis and work together in multidisciplinary teams, and to have a named nurse following the patient to ulcer healing. That is continuity of care. And to do this, I initiated Riksår, the Swedish National Quality Registry, in 2004. The registry is sponsored by the Swedish authorities SALAR, the Swedish Association of Local Authorities and Regions, and also by research funding. And you have to apply for money from the SALAR every year. Riksår now covers the whole country: primary care, community care, and home care, hospital care, and it holds more than 10,000 registrations. And Riksår is used as a clinical practical tool by staff to get the diagnosis, to get the multidisciplinary team, to get the continuity of care, and to follow up the patients at ulcer healing. And it soon became very evident that when using the structure of Riksår, you could gain a lot of benefits for the patients and the healthcare systems, like significant reduction of ulcer healing time by 64%, significant reduction of irrational antibiotic use by 42%, and significant reduction of costs by half, and most important, improved health-related quality of life for the patients. So what was the next step? A registry, you can see the aggregated data for your patient population, but staff, they wanted something else. They wanted to follow the individual patient's healing process. And then we needed another tool. So we started to develop a couple of years ago Dermicus Wound, which is an app with a platform. And the app is used bedside and the variables are transferred directly into the registry. And on the platform, the multidisciplinary team can discuss the individual patient's treatment, and they can also call for a consultant, a digital consultant, in especially complex patient cases. And this was very much appreciated. It became a national decision support system, and it was very much appreciated by politicians, by the authorities. And some months ago, we started a pilot project with Salar to see how it would work in reality. Some 17 communities have started to build wound management team across the boundaries of community care and primary care, and also in hospital care. And this turned out to be a very good and practical example of the ongoing Swedish reformation of primary health care, god och nära vård, the good and near health care. So we have started implementation in a very small scale, and the next step will be a large-scale implementation nationally and internationally. And to support us in this work, we have the Salar, but also the EWMA, the European Wound Management Association, in the long-term research project, optimizing patient and health economic outcomes in Swedish wound care practice. Riksår and Dömikes Wound, we are also part of a long-term research project called Optimizing Patient and Economic Outcomes in Swedish Wound Care Practice. The benefits of implementing this is so great that it calls for action. And all this we have done to really guarantee patients with hard-to-heal ulcers the proper diagnosis, adequate treatment, multidisciplinary team management, and continuity of care. That is, to improve their quality of life.